Well, welcome back and thank you very much for staying with us. Now, the Smile Foundation celebrates 10 years in the Western Cape of putting smiles back on children's faces. Now, the non-profit charity helps children in need with facial abnormalities such as a cleft lip and cleft palate. It works with the country's academic hospitals to bring life-changing surgeries to their patients. Let's welcome, of course, the Foundation CEO, Hedley Lewis. Thank you very much for joining us. First of all, congratulations. 10 years in the Western Cape. How many smiles have you managed to put on kids' faces in the Western Cape and, of course, countrywide?
Well, specifically, obviously, in the Western Cape and in the Tygerberg Hospital, over 950 have been achieved, but we're not doing those surgeries. It's really the heroes are those surgeons and the nurses. Countrywide, we're just over 3,000. And that, I think, is a milestone in itself. But once again, it's 11 academic hospitals across the country that all step up, and it's their surgical teams, their nurses and their CEOs that are making this a reality.
That is fantastic. But of course, it does come with a number of challenges. Of course, the first one being that you need to get to these communities to let them know that there is this fantastic opportunity to get those smiles back on children's faces. And of course, getting them from those communities to these facilities that will be able to help them.
Absolutely. I mean, one of the biggest challenges is for families to realize that regardless of the disability, the deformity, that they have an opportunity to change their child's life. And some of them don't even know that that is an opportunity. So for Smile Foundation, and one of the reasons we're sitting here right now, is the awareness of how patients can actually get into the system so that they can be helped by the National Department and the state. And the next thing is sometimes they're coming from very far and wide, so transport is one of those challenges as well.
With transport being one of those challenges, of course you're partnering with the Department of Health. How do you then circumvent crises such as that, where you obviously have to get to these communities and get them transported to these various hospitals that assist them?
So, I mean, in today's time, transport shouldn't be a problem. But, you know, sometimes you don't know the exact location, the exact address. So it could be drivers, it could be buses, it could be our very own supporters, for instance, the Kalulas of the world that are big supporters and help us fly these patients as well. So every single patient is unique, and every single patient needs that little comforting.
You are getting some assistance, but you know, I think in the greater scheme of the challenges that you're facing, I think the best thing, I guess, would be after the surgery is done and you see this fantastic smiles on the kids' faces. Talk to us a bit about how this changes the life of every single child who goes through this life-changing surgery.
So I think that as parents that don't really realize it, probably can't conceptualize it, but just a sneak preview. So a child that has a cleft lip and palate, for instance, then will be able to eat better, will be able to speak better, their confidence will grow, the community will embrace them, and we often forget that ostracization is not just about color, race or religion, it's also about difference. I mean, it baffles me why you and I don't speak the same language, but that is the reality. And often with children that have differences, they too are ostracized. So by giving them these surgeries or assisting with burns or other reconstructive surgeries, what we're really doing is we're saying to that family, you have the opportunity. We're really saying to them, we are reintroducing them back into their communities, and please God, they should have that opportunity to have the challengers, be leaders, and please God, maybe even the president of our state.
Let's talk about some of these other reconstructive surgeries that you also do before we get to the kind of work that you do outside the borders of South Africa as well. Is that correct?
No, we just primarily a South African, born, bred, and started by Mr. Mark Lubner and the late President Nelson Mandela within our very own country. Continuing,
of course, with that legacy, talk to us a bit about some of the other surgeries that you perform.
So, I mean, we've just come through winter, and winter's probably the toughest period because winter is burns, winter is about anguish and stresses, and because it can happen with a blink of an eyelid, a child can be burnt. These are accidents, no no reason for the parents. It's not the child's fault, but the hospitals are really inundated because of this. Smile Foundation, one of the areas that we support is reconstructive surgery around burns. And going back to the Western Cape, Red Cross Children's Memorial Hospital is one of the areas that we did a burns intervention due to the likes of the Vodacoms who stepped up to say, burns is an important area, let's make a difference.
But I guess, you know, they would say prevention is also better than cure. Are you perhaps working with other institutions as well to ensure that, you know, while you do have this problem during the winter periods where there are a lot of burn victims, do you work with other institutions on more preventative measures, I guess, and creating more awareness?
So I think that awareness is always going to be the key. I think that unfortunately, to date, I mean, our organisation is a reactive as opposed to preemptive.
That's right.
But I think that now the message is, well, parents need to just be a little bit more attentive. But I wouldn't want to say that because we all have children.
Things happen.
And it's, as I said, a blink of an eyelid and something happens and you've got to rush to the hospital. So I'd rather say that we just need to be aware, have a look at how our houses are built, what is in them. And I mean, with winter behind us, it doesn't mean that burns are behind us as well.
But in terms of the work that you've been doing, in particular, let's say that the Western Cape for the past 10 years, are the specific challenges isolated to the different provinces that you're dealing with, or would you have ones in the Western Cape not unique to perhaps some of the challenges that you might face in the Eastern Cape or in other parts of the country?
The Smile Foundation really supports the hospital and looks at what their needs are. So sometimes it's additional psychological support, sometimes it's additional speech therapies. Every area and every hospital is unique. That's why even the donors that are selected are donors that want to have that extra impact. I mean, the Smile Week that we're all looking at, where it culminated, Adcock really said, well, they wanted to be part of that 10-year celebration. So every province is different, every hospital is different, but you also have to have a look at why the team works in advance. Is we're having a look at how we can support the specific lists. So every child on the list, the hospitals then will give us what are their needs, how can we support, and it's really a wonderful opportunity that we get to augment what the surgical support are, the nurses and the mummies of the wards.
But of course, I think there'll be more support that is also required post the surgeries for the kids to understand that you now look different, and I guess some of the challenges like bullying, those things would possibly also come into effect when they see that one child is different. Do you have that kind of support post these surgeries?
So everything works in conjunction and with that support in the hospital environment. So we do have additional psychologists, speech therapists. In the area of clefts, we have an organisation that's one of our projects called Cleft Friends. So that's mommy to mommy support, where the mommy says, I've been there, I know what you're going. And it was really founded by a mommy by the name of Helena Cullis, who really is there to support. So it could be one surgery afterwards, it could be multiples, and every patient needs their own individual support. Cleft lip and palate can be 16 years, burns can be numerous years.
It takes time.
Everything is step by step.
In terms of the support you're getting, yes, you've got the Department of Health, you've got a great working relationship with them, but what additional support do you believe you need to perhaps, stretch this to another 10 years, to another 20 years, so that you could be able to put more smiles on children's faces?
So I think that one of the barriers always is money, and I think that's an extra area. I mean, we've turned to technology and we've just launched our very own Smile Foundation app, which is live, and that allows people to refer, whether they're in clinics, whether it's the public. Funding, I mean, the call out is the more we have, the more we can spend.
That's right.
An NGO by mission and vision is not a surplus organisation. So there's always shopping lists that are there, and the minute that we get more money, the more we can allocate out there. So smilefoundation.co.za is always the opportunity to support, but just as importantly is to refer patients into the system so that we can refer into the 11 academic hospitals across the country.
Smilefoundation.co.za. Thank you very much for your time. The CEO of the Smile Foundation, Hedley Lewis, thank you very much for your time, and congratulations on the 10 years in the Western Cape and for the fantastic work that you're doing, putting smiles on children's faces. Thanks for your time.
Thank you.
Well, we'll have a look at what the weather has